Good afternoon to you, our viewers. You are welcome to your show, my show, our show, the Digging Deep Show. Thank you, as always, for tuning into our program today. Please do let your friend, your family, anybody that you know, let them know the Digging Deep Show is on air. And I've got with me the Chief Executive, Robert, of Cardiomyopathy Association.
Hello.
You are welcome, sir, to the show.
Thank you very much.
And as you might be aware, the Digging Deep Show is digging deep to save lives. We are discussing about cardiovascular diseases, heart diseases, which is the UK's biggest killer. And like I've said, today we've got a man of great influence in our society. Sir, can you tell us what is cardiomyopathy?
Okay, well, cardiomyopathy is a term which covers a group of conditions, but generally it means a condition or a disease affecting the heart muscle. And there are different types, and each of those will affect the heart in different ways.
Cardiomyopathy affecting the heart muscles. How many people have this kind of disease?
Very difficult to say because there aren't good systems in place in the country to determine how many people are affected, and also the way the condition can present can make an early diagnosis sometimes difficult. But just looking at one type of cardiomyopathy, known as hypertrophic cardiomyopathy, it's widely accepted that affects 1 in 500 people. So you wouldn't call it a rare condition. So other types of condition, figures vary between 1 in 2,500 to again 1 in 500. So there's quite a bit of the conditions out there.
Well, this is it might be quite new to our viewers. Yeah, but it is affecting quite a lot. If it's 1 in 500, it is affecting. And can you tell us who in particular it does affect?
Well, again, it can vary. It's, for the most part, it can affect people at any age, any gender, any ethnic background. So it doesn't tend to generally discriminate between different types of the condition, like hypertrophic cardiomyopathy. Again, there is an argument that it can develop through the growth years, from early teens through to early 20s, but even then there can be a late onset variant of the condition.
So do you find this condition in even as young as 2 years of age?
Yeah, you can find children that are affected as well. Yeah.
Tell us about the symptoms.
Yeah. Well, this is perhaps why, when you say 1 in 500, people might think, well, why haven't I heard of this before? Because,
Yeah.
But one of the features of the condition, it has such a wide range of presentation. So you can have some people who will have very minimal symptoms or even no symptoms. Perhaps some people have symptoms, but they don't really recognise them as symptoms. They've just adapted their lifestyle around them without really knowing. And then at the other end of that scale, you can have the first presentation, which could be a sudden death of a person, which thankfully is a relatively rare occurrence, but of course one is one too many, and that's why a lot of work goes in to try and prevent these sudden deaths that can occur. In other types of the condition, you can, with a condition known as dilated cardiomyopathy, where the heart isn't pumping as well as it should, you'll have symptoms of breathlessness due to fluid retention, palpitations, maybe some degree of chest pain or a chest ache, lightheadedness, collapse, near collapse. So everyone is different, and everybody has to be assessed according to their particular condition and the way the condition presents in them.
Can you also tell us how it is diagnosed?
It can be diagnosed where there are early signs, and this is one of the areas where we try to work quite hard to raise awareness of the conditions, is that there can be what doctors might term as being diagnostic red flags. So these are symptoms that somebody might be presenting with, and they need to be responded to effectively. So you can get maybe a person going along to their GP complaining of palpitations, some pains, maybe feeling faint, this sort of thing, and those need to be recognised and then referred on appropriately. Some people might be picked up when they've been screened because they've had a family member affected, and some people may go along and they'll have a routine screen made for insurance purposes, or preoperative for an unrelated condition, and picked up in that way. But it again varies.
With different individuals, like you've already said to us. With this condition, is there any treatments?
Well, yes, there is. It's not a treatment where you would call that you would say there was a cure for the condition.
Mm-hmm.
But we have to remember that there are many conditions which there aren't cures for. Asthma, diabetes. But there are very good treatments to control the symptoms.
Okay, so it's all about the control.
And cardiomyopathy is the same. There are very good treatments which can assist the heart function and go a long way to preventing some of the complications or side effects of the condition.
In case our viewers are just joining us, we are discussing cardiomyopathy, and we've got the Chief Executive of Cardiomyopathy Association, and you are taking us through getting to know what the condition is about and how many people have been affected, and just digging more further into that to raise awareness to our audience. Can you tell us where, if someone has that condition, where can they get the best care?
Well, the first point of call would be their general practitioner, to see them and fully explain what the symptoms are, and then for the GP to be referring on to a cardiology service.
Mm-hmm.
There are specialist centres around the country which deal with what are termed as inherited cardiac conditions, and many people are then referred on to one of these centres for more specialist care.
Mm-hmm. So in cases where somebody knows their father or their mother already has it, in those cases then you tend to refer them at an earlier stage.
Yeah, so if, for instance, a parent was diagnosed with a condition, the inheritance pattern would mean that their children would have a 50% chance of inheriting the gene mutation which is associated with the condition. So it's very important that what are termed as the first degree relatives, so these would be children, siblings, parents if still alive, should then be referred through to cardiology centres to be screened. And the screening would involve an ECG, echocardiogram, maybe other tests like a 24-hour ECG tape, but then for the findings to be assessed by a cardiologist and the person advised. In some, if the child is of a younger age, as I say, going through the growth years, then there may be a requirement to be screening them every year to see if anything's developing. And at some stage when they get into their 20s, there'll be a decision either to reduce the frequency of screening or stop altogether. But again, it's got to be according to what is the need of the person.
Just briefly tell our viewers, what is an inherited disease?
So this is something which is passed on through the genes that we all pass on to our children. So there can be gene mutations, and these are defects in certain genes which can cause these conditions. So it's becoming much more widely understood that these conditions are related to the genetics.
In case of this condition called cardiomyopathy, can we say that if someone hasn't got anyone in their family with that condition, are they still likely to be the first one to have that condition? Well,
possibly. It has to start somewhere. You can have sometimes where perhaps people have a sort of a predisposition to the condition which hasn't shown previously. So in quite a rare number of cases, for instance, you can get it can occur when women are going through the stages of pregnancy, and the actual, maybe the load placed upon the heart due to the pregnancy can provoke the development of a condition as peripartum cardiomyopathy. So that's just one example.
You're right, we're digging deep to save lives. And if you can please explain to us the three main types of cardiomyopathy.
Certainly. Well, as you can see, they're all very difficult words to say, but it's quite a mouthful. As I said before, cardiomyopathy just means a condition affecting the heart muscle. So you have cardio, meaning heart, myo, meaning muscle, and pathy, meaning a disease process.
Okay.
So the three main types are, there's one termed as hypertrophic cardiomyopathy, and this is where you get thickening of the heart muscle walls, often in specific places, not always, but this is thickening in the absence of any other stress placed on the heart. So also, if you looked within the cellular structure of the heart, you could see that the muscular structure was quite disorganised and maybe have areas of scar tissue. And there are particular features of cardiomyopathy in how the heart's functioning and symptoms which can occur with that, which can be rhythm problems, and also where the obstruction is, or where the thickening is, can obstruct some of the flow of blood from the heart. So that's the first one. The second one is known as dilated cardiomyopathy. This is almost the reverse, where you have the heart chambers enlarging, dilating. So the heart is therefore not beating as well as it should. The output from the heart is reduced. So this means that there'll be
Is it that the beat is faster or slower?
Not really to do with the pace, it's more to do with the power of the contraction of the heart. So the output of blood from the heart is reduced. So you can get a build-up of fluid in the body, particularly the lungs, which makes the person feel very breathless, very fatigued due to the lower output. And this is where you get symptoms that come under this heading, which none of us like, but we're stuck with it, called heart failure, which just means the heart is failing to meet the body's needs. It's not pumping as well as it should. And then you've got a third one, which is known as arrhythmogenic right ventricular cardiomyopathy.
That is long. It's a big word.
Which we abbreviate to ARVC for obvious reasons. But this is a condition where it appears to be a defect in the structures which bind the heart muscle cells together. So when the heart is placed under some degree of stress, those can break down, and you can have a progressive small loss of cardiac tissue, which is replaced by fat and scar tissue. So there are others, but those are the three main types.
Those are the three major types. Yeah. And of late on the show, we've had experts coming to speak to us on heart diseases, and they've informed our audience that part of the way they could reduce the risk is watch their weight, exercise, cut down on the salt intake, stop the smoking and things like that. So with this kind of condition, is it still very useful for somebody to watch what they eat? Yeah,
certainly. I mean, that's general good advice for anyone. Taking those measures is not going to stop the development of the condition, because it can be passed on through families. But if you have a heart that's affected by a condition, you want to make the conditions in which that heart is functioning as good as possible. So not smoking, eating a good diet, watching your weight, and all these things is going to be good. In relation to exercise is good, but we have to be careful. We have to be aware that someone with these conditions, it's not prudent for them to be taking part in very strenuous competitive exercise. But that doesn't mean to say that no exercise is allowed. Again, that has to be advised upon on the basis according to what that person's particular circumstances are.
If you say someone has a close family member that's been affected with cardiomyopathy, what should they do to get checked for it?
So if they have what would be termed a first degree relative, so if their parent, one of their parents or one of their siblings has been affected, or even one of their children, then they should be screened. So they should go to their GPs and ask for a referral to the cardiac centre, a referral to a cardiologist, and then to have the test done there, and then they'll have that level of knowledge to advise them what to do next. But the first thing is to go to the GP.
Okay, and how about in cases where you haven't had any case of the condition being in your family, but you just kind of think that you want to go and get checked? Do they give facilities to do that?
Not on the basis of just to do a screen out of the blue. The screening is more focused on where there is a known presentation of the condition in a family. Otherwise, we'll be screening for everything. the logistics and the facilities just don't allow that at the moment.
Can you tell us more about how gene testing works and how it can help families as well?
Sure. Well, when people are diagnosed with these conditions, there is, in some areas, people can be tested for any of the known gene mutations. So that means there'd be a blood sample taken, would go to a lab, and they'd be looking for the known gene mutations associated with the condition in that family. The difficulties are that we don't have full provision of gene testing services in this country.
In the UK.
So there is some need to develop these. And this is where things are likely to change in the near future, because the cost of doing the tests is going to fall markedly with the way the technology is moving forward. So it's an area which we're going to see more growth. But it will be looking for a particular gene for, say, hypertrophic cardiomyopathy in that individual. If they can find that in that family, then they would know what the gene mutation is in that particular family, and then rather than doing the same sort of mass sort of looking at every mutation in the rest of the family, they can do what's known as cascade screening to look for that particular gene mutation in the rest of the family. So they can be then more focused about their follow-up care in somebody. So if, for instance, one of the children is found not to have inherited gene mutation, then they don't need to be seen again. If there is found that there's a child that's got the gene mutation, they can then structure a follow-up program to see them on a regular basis, to see if the condition develops. But also I think to say that this is an area of ongoing research. We don't know all the genes as yet. So you can get people that are affected, but it'll come back as a negative gene test because probably they haven't found that particular gene mutation yet.
So it's quite a long process.
Yeah.
And eventually you should be able to get there. And can you tell us what needs to be done in order to stop people being diagnosed late and then eventually stop many people dying from this condition?
Well, I think it's all about awareness and doctors responding to the signs of the condition appropriately. That's not to say diagnose, but to respond to if a young person for instance goes to their GP having had a history of fainting for unknown reason. That's not something you'd say, well, you're going to grow out of that. It's something which...
Just say forget it, you'll be fine.
Exactly. It's something which deserves a response and an urgent referral through to a cardiology centre so they can be checked for these conditions. So awareness is a huge thing. We're actually, as a charity, we're just in the process of finalising the development of some videos which we're making available to GPs just to help them understand and recognise what can be some of the early signs of these conditions, and then to be moved to patients to be seen appropriately.
And what new treatments are being developed?
Well, there's a lot of work going on all the time around the treatments for the condition, and each treatment has got to be appropriate for each person's presentation. So you'll have the drug therapies, and we've seen major advances in the way drugs are used to treat these conditions. The treatment of what are termed as heart failure conditions, of which dilated cardiomyopathy is one, has just developed so widely over the last few years. So we have very effective drug treatments, and there are newer drugs that are being developed and being brought in. You then have technology such as pacemakers, implantable defibrillators to save someone's life if they go into a cardiac arrest with a rhythm disturbance, and some surgical treatments as well. So there's a lot of things which need to be done, which can be done, and even to the extent where some people may require a transplant. We still have a transplant program.
So you still do that?
Although we do much less now, partly because of the availability of organs, but also quite strongly because of the way other treatments have developed.
Okay, so then that's like the last stage of
Everybody is different, as I'm spend my life saying. Yes.
It is true, everyone is different, and the way you obviously treat another patient is different to the other. But can we say, with all the treatments in place, is it getting any better, or does it seem to be getting worse?
I think I've been working in this field in various roles about 15 years now, and yes, there's certainly improvement. There's improvement in awareness, and there are improvements in treatment, but there is still some degree of lack of awareness, where people may not be giving the advice and the information can be available through organisations such as us. So there's still a lot of work to do. It's very much a developing area, with a lot of research going on, and things are improving, but that's not to say that it makes it any easier for someone
who is affected. It can still get better. That's why your organisation is there. Yeah. And just tell us what your organisation is doing about all this.
Well, we're a charity that is there to try and provide information and support to people that are affected. People that are affected by these conditions, and that may be through diagnosis or a family member being affected in whatever way. There can be a great deal of isolation and misunderstanding that takes place. It's not something which perhaps the general public would know too much about. As you've heard, it's a very varied condition. So we provide a service where we will advise people on what their condition is. We'll give them all the information, answer their questions. We can put them in touch with others that have got the condition. We hold regional meetings around the country where they can come along and learn more about the condition. So in a nutshell, we're basically there to inform and enable people to live their lives with the condition as independently as possible. And we also work to try and improve doctors' knowledge of the condition through our conference programme, so that when patients are going to their doctors, they're getting a better service because the doctor will be well informed about the conditions.
And also, what is your organisation doing in terms of improving the care of the people that have already been diagnosed with the condition?
I think that is through the education activities we worked on, and in the past we've been active in funding positions for nurses and also doctors. So but a lot of it is really about improving people's knowledge of the condition, so people are treated effectively with the up-to-date treatments which are available.
If to say someone has this condition and they're at home, they're sitting there watching, what hope is there for such people?
Well, there is hope that there are good treatments available, and they aren't alone. They may feel like it because it's not something which is mainstream in public knowledge. But I would certainly encourage, if someone is sitting at home watching this and they're worried, then to give us a call. We'd be happy to speak to them.
Yeah, the details will be on the screen. Please do give them a call. If there's any cause of concern with your condition, do give them a call. They'll be there available to help you as much as possible as you could help them. Is there any way that you could tell if someone has it just by looking at them? Can you tell that this person has this condition or not?
Not necessarily. I mean, I think one thing which people with the condition might say is that they don't have any outward signs. So they might be someone who has difficulties with just doing the normal activities of life, shopping, etc. Maybe have to be on some degree of benefit because they're not able to work, but they've got nothing external which you can see. That can be quite frustrating because they look essentially fine, but they've got this condition which is limiting their life to some degree. Others will be living lives normally and showing no signs at all, and leading a very full life, which is what we which we aim to enable people to do.
And then obviously you've mentioned the fact that with some people whereby they don't even know they have the condition, that's where sometimes it could lead to someone getting into a heart attack when they didn't know they had the condition. So then in the end it's best to get checked if it runs within the family.
If it's in the family, yeah.
And then obviously they would know where they stand. And can you tell our viewers more about your organisation and how they can help your organisation?
Yeah, so we, as I said, we are an information and support-based organisation. So we're basically there to try and help when people contact us and to try and reach out, to try and contact as many people as possible who are affected by these conditions. So in the first sense, we would have a helpline where we can speak to people about whatever the issue is concerning them, which may be understanding the diagnosis, the treatments, etc. We can also help them understand the conditions more through our meetings and the information resources we have, booklets, etc. And really just be there if they've got questions or they're not sure. You know, we work on a basis there are no silly questions. So it's you know, silly answers maybe, but
yeah.
You know, people can feel very alone with these conditions, and many people, when they're diagnosed, they'll go straight to their computer, they'll type,
they Google everything.
They'll Google everything, and the thing with cardiomyopathy is you will find pages that will tell you you're going to die within 5 years if you've got this condition, which is not true, but it's on the internet and it's there. Now, if that's the only piece of information people get, then that's going to affect their lives greatly. So it's not true. There are good treatments which can support people through these conditions and help them live.
So they can actually live longer than what the internet would say they can. Yes, they can. Okay. Also tell us, apart from the medical care, what other issues are surrounding people with this condition, cardiomyopathy? Thank you so much. The details will be right on the screen. If you want to be a part of this good cause, please do give them a call, tweet them. Make sure you're a supporter of good things. And like he's rightly said, 1 in 500 people are affected with this condition, runs through the families, and we need to raise this awareness as your organization is doing. So please be a part of this good cause. Thank you very much for coming on the show and for all the information that you've given unto us, all the big words which you've mentioned. Thank you so much for your time. And to our viewers, we appreciate you tuning on to the program today. Thank you to our viewers, thank you to all our sponsors, and especially to the Awards for All for sponsoring this program. Thank you very much. And we are back next week raising awareness on heart conditions. So make a date with us Saturday at 3:30. We'll be right here. Thank you from me and the rest of the Digging Deep Show crew. We say goodbye for now.